Hi guys, my name's Annie Sullivan, and I will be talking to you about the minerals sodium and chloride. So, sodium is possibly the most important mineral in the body. Most of it is hidden in the foods we consume and acquired through our diet in the form of salt, as you all may know. Eating too much can lead to health problems, so it is very crucial that we regulate the amount of sodium in our body. Most of the sodium in the body, which is about 85%, is found in the blood and lymph fluid. Levels of sodium are partially controlled by a hormone known as aldosterone, which is made by the adrenal glands. Aldosterone levels tell the kidneys when to hold sodium in the body instead of passing it in the urine. Small amounts of sodium are also lost through the skin when you sweat. Kidneys, endocrine glands, and the brain are organs that help control the level of sodium. Some major functions. Sodium is a major electrolyte. It helps with nerve impulse transmission, muscle contraction, and relaxation. So if there is not enough of this, then your body won't be able to operate properly. It plays a key role in water balance in the body. So whether you are keeping water in or releasing water, for example, if someone is having the tendency to keep too much water in, then usually they will be told to lower their amount of sodium intake. It also regulates blood pressure and regulates muscles and nerves. The adequate intake is 1,500 milligrams. And Americans consume way too much sodium in their diet, which is about 4,000 milligrams, and that's over twice as much than recommended. Some signs of deficiency. Hyponatremia, which is a low concentration of sodium in the blood. It is diagnosed when there is not enough sodium in the body fluids outside the cells. This can occur if someone is drinking excessive amounts of water. It can also lead to nausea, vomiting, seizures, and even a coma, but this is rarely caused by lack of sodium in the diet. Some symptoms of toxicity would be swelling, increased blood pressure known as hypertension, heart and kidney disease, stroke, and can also weaken bones by promoting calcium excretion, increasing the risk for osteoporosis. And the upper intake level is 2,300 milligrams, which is 1 teaspoon of table salt. And it doesn't sound like a lot, but it is. Some good sources of sodium. Small amounts are found naturally in foods like fruits and vegetables. Oil and vinegar for salad dressing, so you should use that instead of ranch or other dressings. You should buy fresh or frozen poultry, pork, and lean meat. Definitely use spices instead of salt for taste, and avoid processed meats like hot dogs or pepperoni, canned soups, and snacks such as pretzels and chips, or choose the snacks that are marked low sodium or no salt added. And remember, processed and packaged foods are very high in sodium, so we definitely need to stay away from those. Check the label. When trying to reduce your intake of sodium, using the nutrition facts label is the way to go. Nutrition facts label lists the percent daily value of sodium in one serving. Percent daily value is based on 100% of recommended amount of sodium, so less than 2,400 milligrams per day, and make sure to look at the serving size. The percent daily value tells you whether a food contributes a lot or a little to your daily diet. So 5% daily value is about 120 milligrams or less of sodium per serving, which is considered low, and 20% of your daily value, which is about 480 milligrams or more of sodium per serving, is considered high. And also check labels for sodium free, low sodium, reduced sodium. And again, always check the label if you are unsure about how much sodium you are consuming. Now that we've talked about sodium, I'm going to move on to chloride. Chloride makes about 0.15% of our body weight and is found mainly in the extracellular fluid along with sodium. Less than 15% of the body chloride is found inside the cells, with the highest amounts within the red blood cells. Chloride is absorbed by your intestines when you digest food, so chloride is definitely an essential part of digestion. And along with sodium, chloride is also found in salt and found mainly in vegetables. Some major functions: chloride is very similar to sodium. It is one of the most important electrolytes in the blood and works closely with sodium and water to help keep the amount of fluid inside and outside of the cells balanced. Chloride helps generate the osmotic pressure of body fluids and is an important component of stomach hydrochloric acid, which is the key digestive acid. It also is needed to maintain the body's acid-base balance and helps with nerve impulse transmission. The adequate intake for chloride is 2,300 milligrams, but the best way to get the daily requirement is always to eat a balanced diet. Some good sources of chloride would include celery, olives, tomatoes, cheese, table salt, salad dressing, rye, canned food, whole grains, and even kelp or seaweed. Some signs of deficiency: an extreme decrease of chloride in the body can occur when your body loses a lot of fluids. So some signs would be excessive sweating, vomiting, or diarrhea. These can lead to the body fluids becoming too alkaline, known as metabolic alkalosis, low fluid volume, and urinary potassium loss, which can cause further problems in acid-base balance. Some other signs of deficiency would be increased blood pH, abnormal heart rhythm, and poor blood flow. Diuretics can also lead to a decrease in chloride levels. Some symptoms of toxicity would include increased blood pressure and can cause a buildup of fluid in people with congestive heart failure, cirrhosis, or kidney disease. And the upper intake level for chloride is 3,600 milligrams. Signs of deficiency and toxicity are not very common, but again, it could happen. When you put sodium and chloride together, voila, it makes salt. 40% is sodium and 60% is chloride. Salt is very essential for human life. It is one of the elements of the human body that the human body cannot do without. It regulates the water content of our body and produces saliva and gastric juices, which are very essential for food digestion. Sodium chloride supplements are needed if someone is not getting enough sodium in their body. It is an electrolyte supplement which supplies a source of sodium for the body. It can be used to prevent or treat sodium loss due to excessive sweating or dehydration. It can also be used to reduce some types of bacteria. The sodium chloride supplements can either be inhaled, flushed, or taken orally. Depending on the type taken, it can cause different side effects like trouble breathing, nausea and vomiting, swelling, and tiredness. Okay, now I'm going to show a short video just kind of explaining further on how important it is to decrease the amount of salt we consume in our daily diet.
Good morning. In today's Health Watch, pass on the salt. Recent reports may have led to confusion about the amount of salt you should have in your diet. Now, a new study reaffirms the importance of limiting sodium intake. The American Heart Association says the evidence is strong that everyone, regardless of risk factors, would benefit from lowering salt consumption to 1,500 milligrams a day. That's the equivalent of less than a teaspoon. For some people, salt increases blood pressure because it holds excess fluid in the body. This constricts blood vessels and forces the heart to work harder to pump blood throughout the body. 1 in every 3 Americans has high blood pressure, a major risk factor for heart disease and stroke. Now, if your blood pressure is 120/80 or above, your doctor will likely advise a lower salt diet. One way to cut back is to skip the table salt, but most of the sodium in our diet comes from packaged, processed foods, so read labels carefully. Most Americans eat more than double the amount of recommended salt daily, but with a little planning and willpower, we can shake the salt habit. I'm Dr. Holly Phillips.
Okay, so here are just some health facts that were touched on during the video. High blood pressure affects approximately 1 in 3 adults or less, or about 75 million people. Heart disease is the leading cause of death, and stroke is the 4th leading cause of death. So reducing your intake of sodium can really decrease your risk of having health problems. And I know we hear a lot about things just happening in the U.S., but there are other countries like Australia, Canada, Finland, France, Ireland, Japan, the Netherlands, Sweden, and the United Kingdom who are also trying to reduce their intake of salt as well. The research article that I chose, the title was Potential Effect of Salt Reduction in Processed Foods on Health. The study was performed by the Dutch population, starting with people 20 years old and older. The mean blood pressure was 128.2 millimeters of mercury. Results found that when there was a salt reduction in processed food, then that also decreased the blood pressure by 1.2%, and the salt intake decreased by 28%. And when they substituted processed foods, they found a 35% decrease of salt reduction, as well as a 1.5 decrease in blood pressure. They also found a huge reduction in cardiovascular disease and mortality. When the salt intake remained the same, there were 896,500 cases of cardiovascular disease that were projected to occur, but when the salt intake was reduced to the recommended daily intake, the cases decreased by 5.8%, and the mortality rate decreased by almost 1%. So I know many of you are probably wondering if reducing the salt intake would affect the taste of food, because I know I'm wondering the same thing. So I have found that studies that were done showed that reducing sodium up to 20% are not noticeable to consumers, and also consuming less sodium would decrease a person's preference for salt or sodium and lead to reduced consumption. So that's kind of cool. And that's the end. Thank you all for listening, and I hope you have a nice rest of your summer.